This video will review personal protective equipment requirements for droplet and contact precautions with N95. At the end of the video, you will be able to list the PPE required when droplet and contact precautions with N95 are indicated. Describe the sequence for the application and safe removal of this personal protective equipment. Assess the risk for potential exposure according to routine practices and choose personal protective equipment accordingly. For droplet and contact precautions with N95, the equipment you will require includes long sleeve gown, gloves, your fit-tested N95 respirator, eye protection. Before entering the room, start by performing hand hygiene. When using an alcohol-based product, rub until dry, touching all surfaces. This must last at least 15 seconds. When using soap and water, wash hands under lukewarm running water. Rubbing must last at least 15 seconds. You are ready to slip into a long sleeve gown. Make sure both ties have been fastened so that your front and your back are protected. A gown should be worn if skin or clothing will come into direct contact with the patient or patient's environment. It is time to apply the N95 respirator. Choose the product you've been instructed to use when fit tested. Apply the respirator and verify that the seal is intact. Eye protection is required in addition to the N95. Finally, put on your gloves to protect your hands. Put your gloves over the cuff of the gown. You are now ready to enter. Careful removal of personal protective equipment when exiting the room is necessary to prevent personal and environmental contamination. A quick reference guide posted at the exit can be very useful to remind personnel of proper personal protective equipment removal sequence. Gloves are removed first, as they are the most contaminated. Remove your gloves without contaminating your bare hands using a glove-to-glove technique. Then, untie your gown and remove it without touching the outside contaminated areas. Upon completion of patient care, only part of the personal protective equipment is removed inside the room. You are ready to exit the room. You must clean your hands before exiting the room. As well, it is important to remove face protection only with sanitized hands to prevent possible exposure. Keep in mind the 15-second rule of hand hygiene. If you inadvertently sanitize your hands before realizing that the door is closed, remember that the door handle inside the patient's room is considered contaminated and you must repeat hand sanitization before removing face protection. Remove face protection touching only the ties to prevent possible exposure. And once again, perform hand hygiene. You have now completed the review of the droplet and contact precautions with N95 personal protective equipment training.